this is Amin. Amin is my new med student. I'm going to show him some manipulations. I haven't gotten an opportunity to actually show him what it feels like on him. And that's the reason I really do these and post these videos, is because you can see it, but to actually have it done on you is very different. And so it's important for him to see and feel like the different pressure that I'm using and how I'm actually doing things. Do you have pain anywhere?
Not particularly. I mean, my low back is normally always tight.
Okay. So I always start up here. I can feel a first rib up here, and it's different when you feel it standing versus laying down. So I always like to feel it standing and then laying down. And then when I'm feeling, like you see me walk down someone's back when I'm doing this, when I say walk down the back, I literally just am moving my fingers down. But I am feeling the transverse process going all the way down. You stand kind of with your hips tilted forward because you have a little bit of a curve more in your back.
Yeah, I didn't even notice that.
Okay. So here's your iliac crest right here. Okay. Now go ahead and I want you to bend forward like you're going to touch your toes. Okay. Was that hard for you to bend forward?
Yes.
Stand back up. Do that again. Just bend straight forward, but don't move your back when you're doing it. Good. All right, come on up.
Ooh.
What did you feel when you were doing that?
Oh, just my hamstrings are tight.
Oh, your hamstrings. Okay, go ahead and lay on your back. So, because I felt that while he was standing, I can always check a first rib when he's laying down, and so this is your first rib up here. Do you feel the difference when I'm pushing?
Yeah, this one's tender.
Yeah, can you feel like how it's higher up than this one is? So we'll go ahead and treat that. You're not having any neck pain or anything, but might as well. So there's a couple ways to treat it. I use more muscle energy than anything. We can use HVLA, but I tend to use muscle energy first and then finish with HVLA if I need to, which is high velocity, low amplitude. It doesn't crack, but that's essentially what that HVLA is cracking. So we're gonna find that first rib right here. Give me your arm. We're gonna bring the arm up, and I bring it up until I feel it get like harder under my finger. That's my stopping point. You're gonna take your arm and you're gonna pull down this way. So go ahead and pull, and then I'm pushing down your first rib. And relax. Go to the next spot. And then push again, and relax, and then one more. Good. What, does it hurt?
Yeah.
So, shoulders rotated a little forward. So it's still a little bit up. So we'll do the HVLA technique. So you're gonna shrug your shoulder up, and then just relax.
Ooh.
So, that's a little bit better. I wonder if you have a problem with your other rib. Flip over onto your stomach real quick. So it's still a little bit up, and so if I see that, I like to look at the other ribs. And look at like your upper thoracic region. So right in here. Is it bothering you right in here?
Yeah.
Okay. So when I find a posterior rib angle, so I have my thumb on that posterior angle, we're gonna bring the arm up, and then I'm pushing down and I'm pushing lateral, and you're gonna pull down. So go ahead and pull down. And relax. And then go ahead and pull down again. And relax, bring up more, and then one more time. Good.
Ooh.
Oh, that is better. Flip back over. I make my patients move a lot when doing this. It's like a workout. Okay, your shoulder is rotated less forward. That's better.
It hurts less.
Yes, that is much better. Okay. So it's always important to check like the surrounding structures and not just where you have the abnormality. So with your hips, your ASIS here, this is what I'm feeling is the ASIS. This ASIS is up. So it is rotating back like this. So we're gonna take the leg, we're gonna drop it off the table, relax your leg, good. And then you're going to push your knee up, and I'm going to push down on your knee, and I'm pushing down with the ASIS, okay? Good. And you're gonna go ahead and relax. We're gonna push down a little bit more. Do that again. And relax. And then one more time. and relax. Good. Bring your leg up. And then we're gonna recheck, and that's a lot better. So what you see me do a lot is you see me work at the common femoral tendon and the iliacus. So if we're checking the iliacus, if somebody has hip pain or back pain, it's always important to check these. And so I can kind of feel the difference in tightness of the side.
Yes.
Yeah. Okay, so what we do is I could just do a straight downward pressure, which is essentially myofascial release. A lot of the times, bend your leg for me, I will bend the patient's knee up just because it makes it nicer basically. It feels more gentle, right? Like this is the same pressure with your leg straight,
Yeah.
and it makes it feel a little better. So I'm still doing that same myofascial release, but I have your leg in a different position just to help with the comfortability of it. And then I can kind of just move your leg. Now you know why patients are always yelling at me.
Oh!
So there's a big difference with your leg being straight and being bent, right?
Yeah.
Yeah. You have a very tight common femoral, but I mean it's very common when you have people who sit a lot, and if you're studying, like you're sitting all the time and it puts contraction on your hip flexors. Go ahead and bend again. And so for some people, this is where their low back pain comes from. For some people, this is where their hip pain comes from. Push your knee out for me. A lot of people that are older will come in and think that they have bad hips because they have hip pain. But usually, like even most people have mild arthritis and it's not a hip problem. Yeah. It's usually a muscle surrounding the hip that's the problem. That's better. Okay, go ahead and stop.